One moment. It's
Yep.
being a little finicky.
Hello, everyone. We'll be starting shortly. We're just getting on Facebook Live.
Leslie, sorry, what did you say? To me, was that to me?
No, I just said bear with us as we go on Facebook Live to the participants.
Sorry about that.
So we'll just be starting shortly. No worries. No worries at all.
I apologize. It's making me do it all over again because
You're
we
fine.
weren't officially started.
You're fine.
Okay, perfect. We're going live in a few seconds. All right, we are live.
Okay, so welcome everyone to our third Deep Dives webinar, trying to go deeper into benefit topics that our members have lots of questions about. I'm Leslie Edwards-Davis. I'm the Director of Benefits for the UAW UMASS Health and Welfare Trust Fund. And we have some great panelists here today to help answer everyone's questions. We have Virve Moore from EyeMed. We have Hi, Virve. We have Julie Kogan from Ameritas. We have Emily Melby from UHS Optical. And we have Tita Farod King, the admin assistant for the trust fund, and she'll help us make sure we get all of your questions answered. And she will also be choosing a winner for the giveaway today, which is a non-prescription pair of sunglasses from UHS Optical that Emily can help you get if you're the winner. So we'll announce that at the end. And we do have some slides that we'll go through today, and we'll send those to you after the call is over. And I do want to remind everyone that this is a recorded webinar. It's also live on Facebook, so don't say anything that you wouldn't want out in the world. And if you have private questions that involve your benefits, we are here to answer them by email or by phone after the webinar is over. Please put your questions in the chat so that, in the Q&A, so that Tita can monitor them. And make sure that your Zoom account shows your name if you're interested in being the winner of the drawing. Is that everything before we begin? All the housekeeping? Okay. All right, so I'm going to share my screen with you and we will begin. Okay, so this is the third in a series of deep dives we've been doing. You can check out the videos from the others on our website under events. What I wanted to start out by saying is sometimes when grad employees or postdocs sign up for benefits with us, they don't currently wear glasses and they think they don't need vision insurance. So sometimes they skip it. And I wanted to remind everyone, there's no need to skip it. It's a free benefit for you as the employee. And eye exams are incredibly important. They're a time when many health conditions, underlying health conditions, are identified and diagnosed. Young adults between the ages of 20 and 30 should have an eye exam every 2 years. Children should have an eye exam between 3 and 5 years of age. And you should have your eyes checked regularly if you wear glasses or contacts, if you have a family history of eye disease, or if you have a chronic disease that puts you at risk for eye disease. So everyone should sign up for vision. There's no reason not to. And at the very least, you can get in and get your eye exam and make sure that your eyes are in good condition. The eye exam is a huge discount when you have vision insurance. You can pay, the average is $90 for an eye exam, but it can go all the way up to $200 depending on where you're going. And with our insurance, the eye exam is $10. So again, this is a great benefit and you should definitely make use of it. All right, so I'm going to turn this part over to Virve. Virve is our representative from EyeMed, and our vision plan is with EyeMed. And I've given you a snapshot here. There's 2 pages, and I'll get to the second page once we get there. But these are your benefits at a glance, and Virve will walk us through those.
Yes. Thank you, Leslie. Again, I'm Virve Moore, and I am an account manager for EyeMed, and help Leslie navigate through the vision as your guys' vision vendor. So first, let's talk about exam. So exam, a comprehensive eye exam with EyeMed. When you go in-network to an in-network provider, you only have to pay a $10 copay. Now, if you choose to go to an out-of-network provider, which you have completely freedom to do so, EyeMed will cover the cost of the exam in the out-of-network level, which would be up to $50. So always, when we'll go through these scenarios here or different benefits here, you will notice that in-network, the member cost is always going to be lower for you. And then we also cover in-network, we cover the retinal imaging at about $39 out of pocket. And what this is basically you will go and get your eye exam, and there is no need necessarily for dilation or eye drops. The provider actually has equipment in their offices that can do the retinal imaging. It also keeps a really great history annually, of the retina, and to make sure that there's no big changes or anything. So retinal imaging is part of your benefit as well. Then frames, we will cover, you have a $150 allowance. There's no copay. So you basically have $150 allowance. Let's say you purchase a frame that's $160. You can use the allowance of $150. It leaves you a balance of $10. And then EyeMed still covers an additional 20% off the balance, which is, that leaves you $8 to pay for the frame. That was quick math there. Then out of network, if you choose to go out of network for your frame, we cover up to $90. And then different lenses, single vision lenses, you only pay a $10 copay. In network, out of network, we cover it at about $42. So when you send in your receipt for reimbursement, EyeMed reimburses you $42. Bifocal, again, $10, trifocal, $10, and the different levels on the right-hand side, you can see the out-of-network reimbursement. So I don't need to necessarily give you all these examples here. Again, progressive lenses, $10 copay, and then different levels of premium progressives are covered in with the different copays. So those are $30 to $55, depending on the tier. And then the tier 4, which is these tiers are basically mean the technology is better and better, higher the number of the tier is. So in tier 4 is a $10 copay, but then you after we figure out the formula, which is 80% off the charge, less than $120 allowance. So, and then again, all the progressive lenses out of network reimbursement is $78. You can go to the next slide, Leslie, unless you want to add anything.
No, that's
Okay.
great.
All right, perfect. So then different lens options again. Lenses with UV treatment, you pay a $15 copay. None of these lens options actually, as you can see on the right-hand column, there's no out-of-network reimbursement for any of these lens options. And then tint, $15 copay. Standard plastic scratch coating is another $15 copay. Standard polycarbonate material lenses basically is $40 copay. And it's same for adults and kids. Standard anti-reflective coating is $45. Premium anti-reflective coating is different copays again, $57 to $68. And then the tier 3 anti-reflective is 20% off. So but you pay 80% of the charge. And then photochromic, which is transition lenses, those are also 20% off or 80% off retail. 80% off retail this time. The tier 3, so there's 2 different ways. So basically, in the when we talk about the premium anti-reflective coating on the tier 3, it says 80% of charge. You pay, your member out of pocket is 80%. So you're basically only getting 20% off. Then again, we look at the photochromic so that we don't get confused with that one. You actually pay 80. Oh, you get 80. Hold on. Let's see here. I'm looking at this on my paper because that can get confusing here. Let me check on that before I. Yeah. So you in-network member cost for the photochromic is 80% of retail. So you pay 80%. You're so basically getting 20% off. Polarized is 20% off retail, and then other add-ons and services are also 20% off. And then contacts, you have again the same allowance as you have for frame. You have the $150 allowance, and then you also get 15% off balance of $150 as long as they're conventional contact lenses. Disposable, you can use your $150 allowance again for them, and then but you pay the balance over the $150. And then medically necessary contacts are 0 copay. So those are completely covered by the plan. And again, on the right-hand side and right-hand column, out of network is up to $120 for conventional or disposable contact lenses. And then medically necessary out of network, we reimburse you by up to $210. And again, the frequencies, you can go and get your eye exam every year. Your lenses for your frame, you can also get those every year or every 12 months. Yours is date of service. So let's say you go January 5th this year. So next year in 2022, January 5th, you'll be eligible again. And then contact lenses, you can also get those once every 12 months, and again, frame as well. So what's great about your plan is you can get complete the pair classes every year, frame with lenses and contacts in the same year. So that's unusual. Most of the time, vision benefits don't cover both in the same year. So this is a wonderful, rich benefit you guys have.
Yay.
Yay.
Yeah, we did that intentionally because our members need their eyes and they need their eyes to be highly functioning eyes.
Yes.
So yes, we have a very generous benefit in terms of the frequencies that you can use the benefits.
Absolutely. Anything else? Did you have anything to add there? Did I do okay?
That was perfect.
Okay.
That was perfect.
Can
I'm
I
gonna
have some questions?
go ahead. Sure.
Someone asked about coverage for eye exam fee if they're in China, and if there's a process to get reimbursed.
There is. So that would be considered out of network. So the plan would reimburse up to $50. And in a couple of screens, I'm going to go through how you submit a receipt for a reimbursement. So we will answer the second part in just a few moments.
Mhm.
Did you have a second question?
I did. When we go for annual eye exam, is it possible to use the $150 allowance to update the lenses of existing frames we've gotten from our eye doctors in the past?
You mean like only if they're using the frame that they currently have, but only getting new lenses? Is that what you're?
I think that's the question. If the person can clarify. Yes, that's correct.
So if they're just getting new lenses for their existing frame. Emily, how do you guys do that at your practice?
So yes, you can do it. I'd preface it by saying that the opticians typically will help evaluate sort of the condition of your frame and make recommendations on whether that's a good idea or not. If the frame is old and maybe you can't get parts for it anymore, and if that frame then breaks, you'd have to pay out of pocket for new lenses. So sometimes it's not always advisable, but typically the optician can help make that determination.
Mhm. So you can do it, but then the 150, you're really not using the 150
Oh,
allowance.
I'm sorry. Yeah, no, I'm sorry. I answered that incorrectly. I thought they were just asking if they could use their own frame.
Mhm.
You can use your own frame, but you can't take that $150 to like put towards your lenses. I'm sorry, I missed that part of the question. Yeah, you'd still have your frame benefit available to you, but you can't use it to help cover more of the lens cost.
Okay, are there any other questions right now, Tita?
No, not at this time.
Okay, perfect. So we'll pick up with some extra EyeMed perks that come along with your plan. So Vera, do you want to tell us about these?
Oh, absolutely, Leslie. So above the wonderful benefits that we just went through that you have with EyeMed, you also, if you choose to go and use your benefits at Target optical stores, you get your frame completely zero out of pocket. So it doesn't matter if the frame in the Target store is, let's say, a Dolce & Gabbana frame that costs $230, it will be $0 for you out of pocket. So, and these this Target Freedom Pass is only available for you to use in store. So like if you look at this little clip on here, it has an offer code that the person who is helping you at the providers at the Target Optical will need this code to enter at the register for you to receive this offer. And basically then you will be just paying your lens copay and that would be it. So your frame is always going to be free at the Target Optical stores. And what's great about this, let's say you have yourself, your husband or wife, and your children on the plan, you all can use this every year, or everybody in your family can use it once a year. So basically you can take advantage of this offer 4 times, depending or how many ever members of your family are on your plan. And then the other wonderful thing, and right now, especially with the pandemic and everything, if you the online option to use your benefits online, Contacts Direct offers additional savings. So this booster gives you additional 20% off contacts and free shipping at contactsdirect.com. So wonderful value.
Awesome. I definitely want to underscore what Vierve said about all of your benefits are available to every member of your family if you have a family plan. So you don't share any of these benefits across your family members. They're all per person enrolled on the plan. So you have your own distinct allowances for purchasing frames and purchasing contacts. And all of that is completely separate for each person. So definitely make use of that. And it's free to enroll your family members on your vision plan. So it's an incredible benefit for families.
Definitely.
This is another just cut a few little perks depending on what you're looking to do and where you're looking to get your glasses, that there are different discounts available. I don't think we have to walk through all of these, but if you are looking at a particular big retail provider, there are some discounts available here. If you're looking at LASIK, there's some discounts. So you can check this out at your leisure when you are looking through all the materials.
Yes, and Leslie, let me add really quickly on the special offers. So these special offers, if you register online on EyeMed.com, and there is actually on the front page, there's a special offers tab. So, and they are wonderful, especially for 2021. They have made them a little bit even more richer. And these are benefits, or not benefits, but discounts that you can use on top of your benefit. And so check those out. Also, they'll be available if you have downloaded the mobile app, the EyeMed app on your phone. That way they're always there and you can check and see what the special offers are. And let's say you are in one of the stores and you say, hey, here, can we use this discount as well? And, you know, it's a wonderful way to even make that member out of pocket cost to go down and, you know, give you additional savings. That's all I want to add.
Excellent. And the app can be downloaded at Google Play Store and all the
Yeah.
places where you normally download your apps.
Yes, App Store
Awesome.
has EyeMed app, yes.
Perfect. All right. So I think did I skip something? No. All right. So we're going to delve into some examples of using your benefits. And I just wanted to go over some basic terms. These terms are kind of similar across most insurance plans. So in network and out of network, we've already kind of addressed that, but there are dentists who have negotiated rates with the insurance company, and that rate is going to be the best for you and really maximize your benefit. We encourage you to stay in network. There are tons of options for staying in network, and I'll show you how to find an in-network provider in just a moment. Out of network, there's no agreement, so the benefit is reduced. The VRV pointed that out. So on the far right column, you'll see those reduced benefits when you're out of network. And point of service plan year, VRV also covered, but it's good to stress again because it is different from our dental plan. It does not match the plan year. You basically have your own 12-month year, that calendar that you're running, which is your benefit renews after the last 12 months after the last time you used it. And when you register on EyeMed's website, you'll be able to check the last time you used the benefit, which is really great.
Yeah.
All right, so that's not all. So in addition to having a vision plan, this year we have a dental plan that gives you a vision fusion benefit. And that was one of the great additions we were able to add to the benefit package this year. And that is under our Ameritas dental plan. And I'm going to turn it over to Julie to walk us through how that works.
Thank you, Leslie. Hello, everybody. So with your dental plan, so you do have to be part of the dental plan in order for this benefit to take effect for you. But there is what we call a fusion benefit, which is you can actually take $150 of your dental calendar year maximum, and you can actually use that benefit for vision materials expenses. So vision materials like your frames for your glasses, contact lenses, or lenses that go into your glasses. So you can, whatever your out-of-pocket cost is, so let's say you want the best Gucci frames and they cost $300 at, the eye doctor, your plan covers you for $150, and then $150 is going to be out of pocket. Well, 20% off with the EyeMed plan, but, and I'm not doing that math, but whatever your out-of-pocket cost is, you can actually get reimbursed that amount up to $150 every plan year. And the plan year for the dental plan is September 1st to August 31st. So each plan year, you actually have a $150 benefit that you can take if you're not using it all for dental.
Yes, and I see a typo there, so sorry about the materials typo. We'll correct that. What I want to stress that Julie just mentioned is that if you are, and this is a very small group of our members, in need of extensive dental work, you don't want to use this benefit because you want to keep all of your dollars for dental work. Your plan year maximum is $2,250 with the dental plan. And so if you're anticipating really extensive, crowns and fillings, probably wait on this and don't use that until you've done all your dental work and see if you have any room left there to use this benefit, because it will reduce that plan year benefit. But for most people, you have plenty of room to use this benefit. Yes, go ahead.
And in order to, I'm forgetting about what's the next slide, Leslie? I'm forgetting. Is it everything to do with fusion? Okay, good. No, it
Yeah,
doesn't.
so the next few slides are going to tell us like how we kind of put these benefits into place. But do you want to go ahead and?
I just had a comment about the reimbursement procedure, which I know we'll get to, but with people always ask me, well, can I wait till the end of the plan year to figure out if, let's say you bought contacts in January or you had a out-of-pocket expense in January, and I'm going to wait till the end of the plan year because see if I have any dental benefits left. Technically, not really technically, actually, the plan does need to be reimbursed. The fusion benefits should be reimbursed within 90 days of your expense, so your cost. So you really can't use it as kind of a, holiday club or something like that some people would want to do. You actually have to submit for reimbursement within 90 days of the actual expense out of pocket.
Great, that's an important point. All right, so how do these benefits interact? So there isn't an automatic coordination of these benefits. So we are gonna walk you through how to manage this yourself and make sure that you're maximizing everything that's available to you. It's a two-step process, and we're gonna show you how to navigate those steps. So first, like we said, you're going to choose a provider, and we would encourage you to choose an in-network provider. In COVID times, this is even more important. There are options that do not require you to go to a specific location unless you need that eye exam and a new prescription. But if you're just reordering glasses or contacts, there are online options. So we've listed some here. This is just a snapshot and certainly not exhaustive. And if you go to EyeMed.com right here, put in your zip code anywhere in the country, because we have a nationwide network, put in our plan network, which is select, it will give you a whole list of providers that you can go to. So step one, choose someone to see as a provider. We love UHS Optical. It's on campus, super close. If you're in the Amherst area, they're familiar with our benefits. They know grad students, and they know they're just really good and easy to work with. And I am going to introduce you to Emily again, who is at UHS Optical. And Emily, do you want to tell us a little bit about how one sets up an appointment and what the process would be and what they'll find when they go to UHS Optical?
Sure. So we have sort of two parts to our eye service. We have a full-time optometrist, Dr. Gray, and then we also have an optical department with two full-time opticians. Right now, because of COVID restrictions, everything is by appointment. So to make an eye exam appointment, you can just go to the phone number that's in the slides or on our website to schedule an appointment. We additionally also fit contact lenses and medically necessary contact lenses. We're able to get lenses in often the next day or within 2 days. They're sent to our office. And we also have a lot of manufacturer rebates on contact lenses to make our prices often competitive or even better than online pricing. So we also lastly do medical eye appointments. So whether you feel like you might have conjunctivitis or a contact lens stuck in your eye or anything sort of medically related, we're also able to see patients for that as well.
Great. And what is it like to set up an appointment? They call, what's the wait time for an appointment right now generally?
Yeah, so if you call to schedule an appointment, right now we're booking about a month out for students, though depending on student needs, we have been trying to keep appointments available to get people in sooner before the end of the semester. So if you have a particular urgent need, just make sure you let the receptionist know, and we do our best to try and get patients in sooner who need to. Once you schedule your eye exam appointment, if you're interested in looking at glasses, we ask you that at the time of booking, and we automatically put you in for an appointment with optical services. You're also able to wait and do that separately if you prefer to.
Great, great. Anything else that we're missing about UHS Optical?
I don't think so, other than that we have a great selection of frames. We have a lot of frames that are fully covered by the $150 allowance, and just a wide price point from designer frames to budget frames. So I think we do a good job of sort of accommodating everyone and their needs.
Yeah, I hear nothing but good things. So they come highly recommended. And again, they're in network. You do have lots of options though. So you'll make a decision about your provider, and then it's important to make sure you tell your provider that you have insurance. This comes up a lot because it's not something that everyone is used to doing. So you'll want to either have this written down, or you can download your ID cards from your confirmation of coverage emails. There are links where you can download ID cards, but you'll just want to have your group numbers. I've given them here for grad students and postdocs because postdocs might be on this call as well. And you'll have your group number, your member ID will be your social. They can alternately look you up with your date of birth and name most times. And be aware that your family members won't show up on your ID card, but they will be found under your name if you've enrolled them on your plan. So you just need to let the provider know that they'll be able to find your family members under your coverage.
At one point there too, just to add, you know, let's say there's a family and you have children that are over 18, or your spouse is on your plan, and they're obviously, you know, if they're over 18 years old, you will not see their information. They would have to register like online, you know, in order for them to see their eligibility and all that thing online, they would have to register on EyeMed on their own, just because of HIPAA reasons. You can't, like, you know, once you're over 18, that information is not available other than for you. Not even for your parent. So we just make sure to tell everyone, if you're over 18 and you're still under your family plan, make sure to register.
That's a great point. So when you want to look at your own coverage and when you've last used service, each family member would register separately if they're over 18.
Correct.
But the dentist will be able to see everyone on the plan. All right, so step one is complete. You've picked a provider and they're going to apply your insurance at the time of purchase. So you should not experience a situation where you're at an in-network provider and they want you to pay out of pocket for the entire bill and then you have to go submit the claim. That should never happen. Your insurance will be applied and just the portion that you're responsible for should be what you're billed.
As long as that provider is in-network provider.
Yes, as long as that provider is an in-network provider. The important difference is that when you're not in network, it's totally different. And that's why we encourage you to stay in network. Out of network, you will pay out of pocket and you will need to submit that to for a reimbursement. All right, step two is now the second option for paying for vision materials that we talked about under the Ameritas dental plan. So this is a reimbursement. Remember, it's up to $150 and you do need to submit the receipt though. It doesn't happen automatically. And the best way to submit your receipt, the easiest and fastest way, is to register at Ameritas.com. When you get into your account, you'll have a dashboard and you can select the vision tab on that dashboard, and then there is an icon for submitting your receipt. It's super easy, and we have a very helpful video that walks you through the steps and sort of shows you what you're looking for, and we will send that out as a link to everyone after the webinar is over. And it's like a 2-second video. It's just really helpful to orient you, like, wait, where am I looking on this dashboard? And so you'll submit your receipt on that dashboard. I've heard from members who have done this so far this year that the turnaround time is very quick, like 2 weeks, 3 weeks, 2 weeks in that area for getting their reimbursement back. So don't forget to submit your receipt for the reimbursement. I will say one thing before we get into the examples. Sometimes folks have trouble when they're registering on Ameritas.com because their name that they gave us is slightly different than the name they're using when they try to register, or they've moved and they're trying to use a zip code that's different when they register. So if you run into trouble, just let me know. I'm happy to jump on a Zoom with you and share your screen so I can see what you're putting in, see if it's different from what we have, and then we'll get the info updated if it's different. All right, so these are the fun examples we worked out. These are based on lots of member scenarios that we see all the time and kind of explaining how both of these benefits work together. So in the first scenario, you go to an in-network EyeMed provider, you get an eye exam and you get glasses. So the eye exam, the price of it at the provider is $95, but you're in-network and that will be reduced to a $10 copay. The standard lens copay is going to be $10. You've picked out frames that are $250 and your allowance for frames is $150. So there's $100 there remaining. And above the amount that's covered by your plan, there's a discount of 20%. So the total that you've paid at this point is $100. Then you submit your receipt to Ameritas, and the lens and frames are eligible for the Ameritas reimbursement. You submit $90. Remember that the exam is not reimbursable, so that part won't be reimbursed, but the $90 will be reimbursed, and you'll have $60 remaining. Your final cost overall is $10. And that $60 is remaining through the end of the plan year. Is that correct, Julie?
Yes, yes, that's correct.
Okay. All right. I have to just take a pause for one moment. I'm hoping that maybe someone else on the panel can run through this example. Is that okay?
Sure.
All right. Who's going to take that one?
I can.
Okay,
Yes.
awesome. I will be back momentarily.
Okay. So example 2, you go to an EyeMed in-network provider and get glasses, but then you break your glasses 6 months later. You need new frames, but you've already used up your EyeMed frame benefit. And since it's only available for you every 12 months, you cannot, EyeMed will not cover this frame. So you purchase new frames at $278. Leslie made sure to, that's a very high, expensive frame, but, you know, that's cool. But there's no EyeMed benefits available at this time. So you will have to pay $278 out of pocket. Then now Ameritas will cover this, correct, Julie? So you submit that receipt to them, and if the receipt is for $278, the reimbursement is $150, then the final cost will be $128. Did I do that right, Julie?
Yeah, yes, yeah, you did, perfect. Yes,
Okay.
as long as, and the receipt from the eye doctor, no matter where you go, does not need to be itemized. So it does need to show that in this example, $278 was for frames, and it'll
Okay.
typically every eye doctor will have a receipt of some form that will break down the cost between the frames and the lenses and any additional items you may purchase. But that just needs to, that's a key for the reimbursement, is to make sure it's an itemized receipt.
Yeah, very good. Yeah, that is the same, actually, same thing. Anytime that you know, you go to our network provider and you submit your receipt to EyeMed for out-of-network reimbursement, the same thing. It needs to be an itemized receipt.
Yeah, that's a really great point. If you have difficulty getting an itemized receipt, what should someone do?
Most of the time, I think at the provider's office, they can provide it to you if you ask for it. Emily, yours probably, since you're in network for EyeMed, yours is completely itemized, correct? At the UHS?
We only have itemized receipts that we give out. So, but that may
Here's
vary.
there's the random occurrence that if you don't get an itemized receipt, let's say the eye doctor is somehow not online or, you know, it doesn't have a website, you can actually take the reimbursement form, the Ameritas reimbursement form, to the eye doctor, have them complete it in its entirety. The reimbursement form, when you do see it, it's very complex. So that form itself, if you have an itemized receipt, you don't need to complete all of the diagnostic codes and all of those things that you'll see on there. So it will identify it. But if for some reason the eye doctor does not give you an itemized receipt, as long as they complete that form with a copy of a paid, you know, showing that you paid X dollars and those numbers add up, then we'll still reimburse you. So it's a rare occasion that you won't get an itemized receipt nowadays.
Okay, perfect. All right, example 3. So, you know, we definitely encourage in-network, like we've said many times, but there are some people who love some online vendors that are very trendy right now, like Warby Parker, and they do have really cute frames. So if you make that decision to order your glasses there, we'll walk you through what it will look like. So Warby Parker does a combo price for their frames and lenses. They don't kind of break out the different aspects of that cost for you. So in this scenario, you're getting progressive lenses and frames. That comes to $295. The EyeMed out of network benefits. So remember when we showed you those benefits, that's on the far right. It's the reduced benefit because you're not in network. We'll give you a $90 contribution and a $30 contribution toward what you've purchased. And that reduces your cost to $175. Then you're going to submit that to Ameritas, and everything you've purchased is eligible. So you'll submit that $175. Ameritas will reimburse you for the $150, and your final cost is $25. And then your reimbursement has been exhausted for that plan year. All right, I'm going to stop and just see, Tita, do we have any questions we should answer?
Yes, I know you mentioned this, but can you walk people through on how they can find their EyeMed ID card on the website?
I can. Well, I can partially do it. Let me stop sharing my screen. All right. So you'll go to eyemed.com and you'll see members. You'll go under the member tab and you'll go to member login. And at member login, if you've been here before, you'll just log in. Most likely you haven't been, you'll need to register. And this is the starting page for the member registration. So basic info, first and last name, date of birth, member ID, which you might not know, but the last 4 of your social will also work, your zip code, and then you'll create your user ID, which probably, must be your email address, and then create an account. I can't take you further than that because I can't create an account because I'm not a member, but it's very simple. I haven't heard of anyone really having issues with this site.
It is extremely user-friendly and easy to navigate. So I encourage everyone to do that and register. It is so easy to, look at all your benefits, look at your eligibility and what you have available, look at your explanation of benefits. It shows you the claim information. It shows you a lot of information that is great to have. And your ID card is also there. And now, again, I also encourage getting the mobile app, because the mobile app will always have your ID card with just a shake of a phone. It will be available for you when you need it. So that is extremely helpful. And on the website, you can also, EyeMed sent you, probably when you first signed up to EyeMed benefits, we sent you an ID card. The welcome packet comes with 2 ID cards with the subscriber's name. If you didn't receive those or need an ID card and don't know where you put it, you can go to the website, print an ID card for yourself, there's that's available there to print. And again, the mobile app will host the ID card as well.
And while we're doing this, why don't I just show the same for Ameritas. So I do have an Ameritas account that I can log into for you. So you're going to the sign in the top right. And then it will ask you what kind of account you have. So you're going to personal accounts right here on the far left, member sign in. All right, bear with me. And I have already completed the first step of this. So I am kind of skipping a step that I can't really show you because I can't go back in time. But the first step is to actually register. I'm going to just log in if the code will arrive. Oh, right. It's in my email. All right. All right, so this is what you will see, similar to this when you log in. And to submit your receipt for reimbursement, you'll go to Vision and then submit a vision claim. It's as easy as that. There's also the ID card download button. If you go under dental, you'll see other icons here, but this is where you're going to go to submit that receipt for the vision reimbursement. All right. Any other questions right now, Tita?
Yes. Someone asked if they could submit multiple claims for the same receipt to Ameritas as well as EyeMed in case EyeMed doesn't cover all of it.
So the best thing is multiple receipts for the same person. So as long as they are for the same person, then you can submit multiple receipts with one claim, if you will. Because the claim form is for multiple, or the claim is allowed for multiple people in your family, you want to make sure you submit a claim per person, but they can be multiple receipts.
I think their question is, so if I went to went to the eye center or and I'm not sure if if EyeMed will cover it, can I submit it to both EyeMed and Ameritas at the same time? I think that's their question.
So you'll want to
okay.
submit it to
Sorry.
EyeMed first. You'll want to submit it to EyeMed first. Always submit it to EyeMed first. EyeMed is your actual vision plan, and then wait for them to respond. And I'll show you in a few slides here what their response will look like. They'll send you an estimation of benefits. And then once they respond, then move to Ameritas and submitting your receipt there.
So I just want to make one thing clear as well. So when you're seen by an in-network provider, the provider is going to submit the claim for reimbursement. So you don't actually have to submit it as long as they're in-network.
Yes.
You would just submit the receipt.
Yes, thank you, Emily. That is a good correction of mine. So all of this kind of takes place behind the scenes if you're seeing an in-network provider, and you'll just know the result after it's all paid and done. All right, any other questions?
Yes, someone was wondering, would they need to create an account for their toddler if they're on EyeMed? And
For their toddler?
Yes. So for someone who's under the age of 18,
No.
they need to create a
No,
separate
if someone under 18-year-olds will show with the parent or the subscriber's plan. But if they're over 18, those children over 18 would need to have their own registration.
The next question, someone asked, are sunglasses covered? Not the medicated sunglasses, but those that help with UV.
Those would be non-prescription sunglasses, so you would receive a 20% off discount for any non-prescription sunglasses at in-network providers.
And there is no Ameritas reimbursement for non-prescription sunglasses. All right, sorry, is there another question?
Yes, one final
Okay.
question.
Got it.
Can the Ameritas benefit be used more than once every 12 months?
Yes, so you can use the benefit up to the $150 per plan year. So if you have a $75 expense in January and then another $75 expense in August, you can submit them separately. You can submit them, actually that example, you need to submit them separately because of the 90-day rule. But yes, you can submit up to the $150 as many times as you like. Up to that 150.
Okay. I'm going to share my screen again and resume with the examples. All right, so in example 4, you go online to get glasses at an in-network provider, glasses.com, and you want to add anti-scratch coating to those glasses, and you want to get a second backup pair of glasses just in case, but we're not going to add the coating to those separate backup glasses. First, I want to say that people have had really good experiences using glasses.com. You put in some very basic information and it will bring up your insurance and incorporate that right into your process as you're picking your glasses and going to your cart to check out. So I've heard really good things about that. They make it easy for you. So the way that your EyeMed plan will work is that let's say you pick out $199 frames. The $150 allowance will be applied to that, and then 20% off the remaining balance. Let's say your lenses are $55. Those are going to reduce to a $10 copay and a $15 additional copay for the anti-scratch coating. And then for your second backup glasses, so the second pair of frames you picked out is $165. The second set of lenses is $125. You get 40% off a complete pair, an additional complete pair when you're in network. So your total balance at the end of that is $238.20, which you then go over and submit to Ameritas and access your $150 reimbursement, which leaves you with a balance of $88.20. All right, I'm going to advance just to our final example here. And I hope that I did this correctly, but you'll have to jump in, Virve, if I did it incorrectly. So I wanted to give folks an example of using their Target Freedom Pass. So let's say you want to get prescription sunglasses. You choose Target as the place where you want to go. Target is in network and has the Freedom benefit, the Freedom Pass. So those frames for those sunglasses are going to be $0.
Correct.
So you're only going to be paying for the lenses and the tinting, and that totals to 25 bucks. So remember that the tinting is not an eligible expense under Ameritas, but the other materials of prescription sunglasses are reimbursable. So you submit your 25 that you paid, they'll reimburse the $10 for the lenses. Your final cost is $15. All right, so those are some examples of kind of how these two benefits interrelate. I did want to show you an example of an estimation of benefits. These can be really scary for people and intimidating, but they don't need to be. And you just need to sort of orient yourself toward what you're looking at when you get one. This also is an example where no benefit was applied. So typically you won't see an example like this. For this person, they had already exhausted their frame and lens benefit for the year. So this would be a case where you've already got your glasses and contacts, you got them 2 months ago. For some reason you want additional ones. They won't be covered by your EyeMed plan. You still could submit them for reimbursement under your Ameritas Fusion benefit. But I just mostly want to just orient you toward what this looks like and what the different terms mean. So submitted charges are what the vision provider submitted as the cost of what they provided. The covered amount is your benefit that you have available under the plan. There might be various discounts. There might be copays that you're responsible for. Then there's the amount that the plan paid out for you, and the member responsibility. If you see that the coverage isn't applying the way that you thought it would, these remarks are very important to take a look at, and there will be notes about these remarks at the bottom of the EOB. So if for some reason you thought you were going to have this benefit covered and you don't see it being covered, and you see a member responsibility that you weren't expecting, take a look at these remarks. There could be something that you weren't thinking about, like, oh, I tried to submit a claim for glasses before I was covered on the plan. That's not going to be covered. Or maybe the provider had the wrong information when they submitted your claim, and it will say they can't find a benefit for this person. That comes up frequently, and it's easy to fix. Usually it just means that there's a piece of information that's wrong in someone's system, and it can be updated and fixed. So this is really important to just try to work your way through and see what it's trying to tell you. And it doesn't mean doom and gloom necessarily. Most of you will see something where it shows everything being paid exactly how you anticipated that it would be paid. Anyone want to jump in with any comments on EOBs? Okay.
Yeah, and this would be the perfect example just for reimbursement.
Yep.
First, to Ameritas. So if you submit this claim, this form, this EOB, along with your paid receipt, this is the perfect example of what to submit to Ameritas, because it identifies everything and itemizes each of the expenses. So that would be what you would submit.
Yes, even in this terrible scenario where Susan Sample had already used her benefit, she's going to send this receipt to Ameritas, and let's see, the frames are reimbursable, the lenses are reimbursable, and not the tint or the polycarbonate, correct?
Right.
So you could submit the charges for these top two items, and I'm not sure what premium A&R is.
You mean anti-reflective?
Anti-reflective, yeah, so that won't be reimbursable either.
Right.
But the $70 and this $24 can be then sent to Ameritas for reimbursement if you haven't already used it. Tita, do we have questions?
We do.
All right, let's pause again.
One of the questions is, can you get prescription glasses and prescription sunglasses together in 1 year?
You can. Like the example that we had, EyeMed will cover your first pair with the benefit. So you use your $150 allowance for the frame, and then pay your lens copay. The second pair will be, as long as you go to in-network provider, the second pair will be 40% off. So yes, you can do that. Any consecutive pair, like EyeMed does not limit you to just one pair of glasses a year. One pair will be where all your benefits that you're entitled to, those cover the first pair, but then any additional pairs that you want to purchase are 40% off, as long as they're complete pair of glasses, meaning frame and lenses. And they could be the second pair, the third pair, or whatever. That can be a prescription sun, as long as it's a prescription pair of glasses. You'll get the 40% off.
And the Ameritas reimbursement also again covers prescription sunglass materials, but not the tinting.
Right.
All right, so these are those EOB terms I just went over, but if you get an EOB and you have questions, you can refer back to this, or we can help you walk through it. We kind of already touched on this. Registering on the EyeMed and Ameritas sites will be of great benefit to you. So we encourage you to do that even before you have something that you want to submit, just to have that set up so it's easy when you need to go there and download an ID card or check how much of your benefit you've used already. This is the EyeMed out-of-network claim form. The only reason you would need to use this is if you went out of network or you were out of the country, which is also out of network, and used your benefit. And it's a very simple online process to submit a claim for reimbursement. But again, keep it easy for yourself, go in network, this all gets done for you and you don't have to worry about it. We already went to the Ameritas site and showed you how to submit a vision claim. This is a cheat sheet for some questions that you might not know the answer to on the vision claim form. And we have this on our website. And also if you're in the middle of filling it out, you can message us from our website and we'll just shoot you over this picture that you can refer to, but it gives you the common answers to some questions that are asked on the form. And then just to recap kind of the big points from today. So pick an in-network provider if possible, go see Emily. Ask for an itemized receipt if they aren't giving you one automatically if you're out of network. But again, you don't need to worry about that if you're in network. Submit any out-of-pocket materials costs that weren't covered by your EyeMed plan to Ameritas. And always call and ask questions if you need help. We're available by phone, by email. If you're on our website, you can message us instantaneously. There's lots of ways to reach out and get your questions answered. The last screen here is just again your plan information. Make sure that you have this somewhere accessible. Don't forget to tell the provider that you have insurance. I have seen this come up again, and it just makes it more complicated when it doesn't need to be. As long as you're in network, just tell them you have the insurance and it will streamline everything for you. So any last comments to add before we take final questions? Panelists?
Nope, I don't have anything.
Nope, me neither.
Tita, are there other questions?
Yes, we have one question on Facebook Live asking, how do we check if we have, if we use our benefits?
Okay, so you will go register on EyeMed.com. It will look like this when you click, first you'll click on member on the site and it will take you to a place to log in. And if you haven't logged in, you'll create a registration on their site using your basic name, date of birth, last 4 of your social, and it will take you to your account on for EyeMed, and you will be able to download an ID card and also check the last time you used each of the benefits. So you'll see the last date that you got frames, the last date you got contacts, the last exam you had, and it will give you automatically the next date when you're eligible to use those benefits.
That is correct.
I mean, I think providers can also answer that for you. Am I right, Emily? If you're at the provider?
Yes, we can easily see when someone's eligible. They could always call as well if they were having any issues checking.
Yeah, and I do know that UHS is really good about letting people know, like, you haven't used your benefit, like you could use it. I mean, I hear that anecdotally. So, I mean, I think they try to help you manage that timeline. Let's see, are there other questions? It
Nope,
looks like
no other questions.
Yeah, it looks like we've answered everything. I'm just checking the chat here. Okay, so I think that will conclude all of the information we have today about maximizing your vision benefits. Tita, do we have a winner for the non-prescription sunglasses?
Yes, Ishita Dasgupta. I'm sorry if I mispronounced your name.
So Ashita Dasgupta.
Yes.
All right, we will be in touch with you after the webinar is over to get you in touch with Emily so that you can get your sunglasses. Very exciting. All right, thank you everyone for participating and for contributing with questions. Again, we'll follow up with you with these slides so you can reference them and some other information. And yeah, go out and get your glasses and your eye exams. You have the benefits, so please use it. Thank you all of our panelists today. Much appreciated.
Thank you, Leslie. Thank you, everybody.
All right, thanks everyone.
Have a great day.
Bye.
Bye everyone.
Should I just end it?